Dr. Budoff, what is trigger finger?
Trigger finger is when one of your fingers gets stuck down. Usually happens worse in the morning, gets stiff, or you're moving it and it clicks and it hurts a lot right here. Or it can be stuck down and locked and you have to pull it and that really hurts. It's extremely common. It's related to the other space problems in the hand like carpal tunnel syndrome where the nerve is pinched, cubital tunnel syndrome when the nerve is pinched at the elbow, or de Quervain's tendonitis where the wrist tendon is pinched here.
What causes trigger finger?
Trigger finger is a space problem. All of the tendons and the nerves to the hand go in these tight tunnels. So if there's too much stuff in the tunnel, like there's swelling or there was an injury or you overdid it or something like that, or as people age, some of us get smaller, tighter tunnels, and so that pinches into the tendon or the nerve. And when the tendon right here gets pinched, going to the finger or to the thumb, which is also very common, it's a space problem. It's like trying to get a 10-foot truck under a 9.5-foot bridge. It gets stuck, it gets caught, it hurts.
How is trigger finger diagnosed?
This is a pretty simple diagnosis. If you wake up and your finger is stuck down, if you wake up and it moves but it's slow or it's stiff and there's a click and it hurts right around here, that's trigger finger. Sometimes it's more subtle, it can get stuck extended and then you can't really flex it down. Putting your hand under hot water, getting going, getting your body temperature up to increase the temperature in that area so it moves quicker. We're like butter, the warmer we are, the easier we move. And that helps, that's trigger finger.
How do you treat trigger finger?
Well, going back to the analogy, basically it's stuck here. The tendon is like a 10-foot truck getting under a 9.5-foot bridge. It's stuck. First thing you do is let some air out of the tire. So that's a steroid injection. It's a huge anti-inflammatory. If you catch it early enough, it can help. If you get to it within 4 months, odds are, your mileage may vary, but odds are the injection may take care of it permanently. After 6 months, the odds are against you. So like most things, the earlier you take care of a problem, the easier it is to solve. So basically, if you inject it, that's like letting air out of the tire of the truck. Sometimes that doesn't work and you need to pursue a surgical solution like raising the bridge, which is minimally invasive, takes about 6 minutes for the procedure, although if you're coming in for it, obviously it ruins your morning.
What happens if trigger finger goes untreated?
Triggering leads to stiffness. It usually progresses over time. It can go from just being stiff to catching to locking to getting stuck, and you just can't move it. Also, the hand can get stiff. Use it or lose it. It hurts when you use it, so you tend not to. So then you can lose the ability to make a fist or to fully straighten the finger.
Thank you for your time today, Dr. Budoff.